Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Kenya Eddings, and she is the Executive Director of the Arkansas Minority Health Commission. Kenya, thank you so much for being here.
Thank you.
So tell me about the commission and what it does.
Sure. So the Arkansas Minority Health Commission was founded more than 30 years ago by Dr. Joycelyn Elders, and our mission is to provide equitable access to all minority Arkansans for healthcare preventative health screenings. The overall goal is to reduce cardiovascular disease and bring those numbers down, and we know that when we help minority Arkansans, we're helping all Arkansans. So that's the overall mission of the Arkansas Minority Health Commission.
And what are the biggest health disparities, health issues that you're seeing facing Arkansans?
Oh, wow. Where do we start and how much time do we have? Well, we do know that heart disease is the #1 cause of death for all Americans. We also know that heart disease is the #1 cause of death for minority Americans, specifically African Americans. So there's much work to be done as it relates to, trying to reduce hypertension, blood pressure rates, blood sugar rates, cholesterol rates, all those things that go into heart disease.
And your group does a lot of screenings, health fairs, that sort of thing. Tell me a little bit about that work.
Absolutely. So the Arkansas Minority Health Commission serves all 75 counties. We make it our mission to visit all 75 counties at least once in the fiscal year. So I'm proud to say that last fiscal year, we were able to service all 75 counties at least once. Now, what does that mean? We have a mobile health unit that's really popular. It's in high demand, and we take that mobile health unit, which has 2 full-size exam rooms on it, all around the state, performing preventative screenings, as I mentioned, blood sugar, blood pressure, cholesterol. We can do all sorts of other screenings like HIV screenings. We've partnered with UAMS to distribute fit kits to test for colon cancer. We have a variety of partnerships, and we take those partners on the road with us when we can, so that we can help to reduce those chronic disease risks around the state.
Well, I have no doubt that you're reaching and saving lots of lives, I'm sure, from
Yes.
corner to corner.
Literally from corner to corner, yes. And our mobile health unit travels 3 days a week. So for 1 week, we'll be on the road Monday, Wednesday, and Friday of 1 week. And then the following week, we'll be on the road Tuesday, Thursday, Saturday. So we're somewhere all the time.
And if someone wanted to find where you were going to be next, how do they do that?
They can check out our website, arminorityhealth.com, or they can go to the Arkansas Department of Health website and click on the link that says Arkansas Minority Health Commission, or they can give us a call at 501-686-2720.
Lots of resources out there.
Lots of resources, and we're happy to help.
So let's talk a little bit about additional resources and things. So the commission helps with transportation and has different programs.
So we don't help with transportation, and I'm glad you brought up transportation, because with Arkansas being such a rural state, transportation is an issue for people to get the access to the health care and the preventive screenings that they need, which is one of the reasons why our mobile health unit is so popular, because we know that some people are homebound, some people don't have cars, some people don't have access to public transportation, and so we're literally able to meet people where they are by bringing our mobile health unit to communities, parking at a grocery store, parking at a school parking lot, parking at a church parking lot, go into a park, and people can actually come to us. We go to them so that we make that access. We level the playing field as it relates to access.
So it's not just urban areas too.
No, rural areas we go. As a matter of fact, I just thought about in June, for Juneteenth, we were down in Wilmot, Arkansas. We were also in Earl, Arkansas as well, providing those preventative services, literally meeting people where they are so that they could have that access.
And let's talk, aside from transportation, let's talk about food deserts and,
Sure.
and what your organization does for that.
Sure. So we were honored to be a part of, #1, Governor Asa Hutchinson's Food Desert Work Group. And then after that, we were able to be a part of the City of Little Rock's Food Desert Task Force, helping to address and solve the issues as it relates to food deserts. We know that Arkansas now has at least one food desert in every county. And, that's a problem. And so we are doing the research that it takes to figure out why we have these issues and how we can address those challenges. We know that for most communities, a brick and mortar grocery store is not going to be the answer for them anymore. Lots of people, they're used to the brick and mortar grocery store. They want the brick and mortar grocery store to come back, and we get it. But for a lot of communities, that's not going to be the right solution for them because of a variety of reasons. But we've done the research, we've done the development, we've gone on field trips to visit other states and other partners to see what they are doing without brick and mortar stores. And there are some novel ideas out there, some novel solutions, and we were able to bring those to Arkansas recently and host an inaugural Food Desert Summit with the Arkansas Hunger Relief Alliance. And we got tremendous response. And I think that some of those solutions communities are going to be able to use to take back to their community so that that access can be there. Access to healthy food can be there for the community.
And when you say brick and mortar, what are the alternatives? Is it at food pantry?
Oh my gosh, there's so many alternatives out there. So one of them is called, it's basically a mobile food grocery store on a truck. And so this is a nonprofit out of Memphis, Tennessee. And so this particular nonprofit purchased basically an 18-wheeler truck for all intents and purposes and converted it into a mobile grocery store. So what they do is they visit various neighborhoods throughout the week. They park it for 3 or 4 hours. They let the community know that they're going to be there in that food desert, and people come and they do their grocery shopping on this converted 18-wheeler truck. The beautiful part about it is not only it's wheelchair accessible too, so it's ADA compliant, so those who are bound to wheelchairs or have other physical ailments can still access the grocery store. It's a grocery store. It's just not in brick and mortar. So that's just one of the solutions that was brought to bear in this particular summit.
What a neat idea.
Oh my gosh, so outside of the box. Mm-hmm. And when you get people to thinking that, there are other ideas out there, let's just look at them and see how it may work. And I know that there were a couple of communities there who were at that particular summit. The light bulbs, you could just see the light bulbs go off and say, hey, this might work from our community. Let me take that back.
Well, tell me a little bit about the Food Alliance with the City of Little Rock. That's a neat program too.
So the Arkansas Hunger Relief Alliance, which is currently led by Kathy Webb, she's also vice mayor. She partnered with the City of Little Rock, and then we were also able to partner with the City of Little Rock on the Food Desert Task Force, along with other private organizations, as well as several residents in the city to be a part of the food desert work group, because we want all parties who are affected and who can make an impact at the table. We want to hear from the neighbors. What concerns do you have? How can we help? What do you see as the future of this food desert for your community? And then bring in those experts too to kind of help facilitate conversations, do focus groups, ask questionnaires. And so from that, we were able to think about, some solutions for the community.
Let's switch gears just a little bit.
Sure.
And since we're back in the middle of a school semester, and we are still coming off the heels post-COVID, and one of the concerns I'm hearing is vaccination rates among kids and families. Are you seeing issues with that in minority communities as well? Yeah, so there's been historically some reticence for vaccinations for obvious reasons. We know what the history is, but we encourage people, not just African Americans, but all Americans, everyone, to talk with your healthcare provider, to learn about what vaccination or what immunization is going to be right for you, your family, your child, so that the whole community is protected. As Black populations do have the highest infant mortality rate as well in the United States, and I know your organization is also doing a lot to kind of shape that as well in Arkansas. Absolutely. And so we know that not only is infant mortality high for African Americans, but maternal mortality, morbidity, and mental health are through the roof
for all moms, and particularly for African American moms. And so doing the necessary work that it takes to help raise awareness, raise education, and then putting in programs that will help to reduce those numbers. I'm really proud of the work that the Maternal Mortality Review Committee is doing to kind of help address. They study all deaths, all mothers who pass away within 1 year of giving birth. They study that. Why did it happen? How can we put in some programs to make things better, to reduce that risk? And the same with infants. It's called PQRC, Perinatal Quality Review Committee, that has just been implemented in Arkansas. And they're doing the same thing with infant mortality. So I think with those two combined, we can really make a difference. And I'm really glad that people are starting to be aware of the death rates, of the morbidity rates, of the maternal depression rates, because let's just face it, it's been here for quite some time. But now, we're finally shedding the light on the issue, and I'm hoping that we can reduce those numbers as we move forward in the future.
And you mentioned infant mortality too. Does breastfeeding come into play with that as well,
Absolutely.
and education programs for that?
Absolutely, and we know that breastfeeding rates among Arkansans is not as high as we'd like it to be as we are compared to others around the United States, but we know the benefits of breastfeeding for both mom and baby. A lot of times, moms and adults just have not made that connection that breastfeeding can not only help the baby, but it can help mom. And there are so many benefits. It helps to reduce type 2 diabetes. It helps to reduce certain types of cancer, breast cancer, ovarian cancer, and it also helps mom to shed those unwanted baby pounds so that she can get back in shape. But the most important thing I think it is that it gives mom the satisfaction to know that she is giving her baby the best start in life if she breastfeeds or when she breastfeeds. And that's beneficial for baby. We know that the American Academy of Pediatrics recommends breastfeeding and only breastfeeding for babies unless there's something medically necessitates that the baby not breastfeed. But we know that breast milk is best.
And are you seeing a difference within minority communities, some hesitancy to not breastfeed? Is that what studies show?
Absolutely, there is hesitancy, and there are a variety of reasons why. Again, we go back to history, but we learn from history, and we take the research that comes in through what we're currently doing, we apply that to history, and we say, hey, we go out to communities and let them know, although this is what happened in the past, here is how breastfeeding can help you and baby. We know that for a lot of minorities, African American women, that historical context is there, but moms have to go back to work. There's not a lot of time off so that she can bond with baby, so that she can, express milk, then store it up. She has to go back to work. And so those stress factors, having to be on the schedule, having to take the baby to daycare, having to run the family household, things like that just kind of put breastfeeding on the back burner. But we want to let mom know that this is just as important and try to help her figure out ways to do it. Maybe she can express her milk at work. There are 2 laws on Arkansas's books that protects a woman's right to breastfeed. One, she can breastfeed in public. And number 2, she can use her paid time at work to go and breastfeed or express milk for baby. So we know that those laws are on the books. It's just a matter of educating the public and educating the community.
And it's not just Black communities as well.
Exactly.
You see it in rural communities across the state?
Absolutely, because again, it's the education part of it, it's the access, but we know that there are programs like WIC that are out there that really help to support mom and baby, women, infant, and children. That particular program helps to support, and also with WIC, there are peer counselors, breastfeeding peer counselors, moms who have breastfed, who know what it's like, who can provide that support to new mothers entering the WIC program and just be there as a resource. We also know that SNAP is also a resource for mothers as well. So there are a variety of resources out there, but still there's so much more that we can be doing and that we are doing to kind of help.
And your research is also showing that that white adults in rural areas have a steadily rising early mortality rate too. Why is that?
That is a good question, and I think that if we all knew the answer to that, we'd be millionaires. but I think that some of the problem is that some of the challenge is that access to healthcare, access to the preventive services, which is why it is so important that we lean on our local health units. There are at least one local health unit in each county. Some counties have more than one. There are community health centers around the state that provide that access as well. We know that, hospitals are closing down for a variety of reasons. Again, like we mentioned earlier, transportation is an issue for a lot of people. When we have the food deserts that have come about, combined with the access to the preventive health care, preventive screening, that affects everyone. And so we see the morbidity and the mortality rates rise as a result of that, because chronic disease rates rise as a result. And again, like we mentioned earlier, heart disease is the number one cause of death for all Americans.
So it's addressing health, economic, and geographic disparities. I mean, all of those things come into play for what your organization does.
Absolutely. And I think that the beautiful part about our mobile health unit, which again travels to all 75 counties, if someone wants our mobile health unit to visit their county or their neighborhood, just give us a call, 501-686-2720. But again, bringing the access to communities, and the Minority Health Commission has a mobile health unit, but there are also other organizations and nonprofits around the state who also have units that can be dispatched and deployed into various communities.
So really incredible programs and things that you guys are doing. Before we go, tell me what's ahead. What do you want our audience to know about what's ahead for the commission, and where do you see the next step is? What is it?
Oh my gosh, there are so many things that we're doing at your Arkansas Minority Health Commission. It's not ours, it belongs to the entire state, because we don't turn anyone away. So again, our primary thing is providing and making sure that all minority Arkansans have access to preventive health care, preventive screenings. But not only that, servicing everyone. We don't turn anyone away. Our big thing right now, and it always has been, is cardiovascular disease risk. We do that through a number of ways. We have our mobile health unit that travels around the state, but we also have a number of other programs, like our really, really popular Southern Ain't Fried Sundays cookbook and meal plan. It is a 21-day plan that is designed to help us to prepare our favorite comfort foods in a different way so that we can reduce that cardiovascular disease. We can reduce cholesterol, hypertension, blood sugar, just by changing the way we eat. A whole big thing now is food is medicine. And so we know that what we eat impacts how we feel and can impact our numbers. So we have that Southern Ain't Fried Sundays meal plan and cookbook. We also have something for the kids too. It's called Camp ICAN. It's a 3-day summer day camp for kids ages 9 to 12. We focus on physical activity. We focus on kids in the kitchen, doing a cooking demonstration and exercise with them. We do yoga, and we've partnered with Recycle Bikes this year to provide a bicycle for each kid as well as a helmet, so they get in that physical activity. For some kids, this summer was the first time they've ever had a bicycle. And I mean, I'm getting goosebumps thinking about it. But being able to stand in the gap and fill the gap for where that access is not there is our whole mission. And that's what we're most proud of.
Changing lives across the state.
Changing lives across the state, absolutely.
Well, thank you so much for being here.
Thank you for having me.
Thank you for the incredible work that you're doing. I've learned a lot today, and not only that, but to seeing that it's Arkansans in all types of areas and communities.
Absolutely.
Really amazing work. Thank you.
Thank you for having me.
Sure. And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.